There's an important organization out there called Do No Harm, and they sent us some data points that you need to know about. If children, protecting children, our most precious cargo, is important to you, this organization is doing the Lord's work, in my view. The butchery of children through this godforsaken thing that we now entertain as gender reassignment is going on to the tune of tens of millions. Really, it's a billion-dollar industry in children's medicine and children's health care. And it's going on right under our noses, in many cases funded with your tax dollars. And so this organization, Do No Harm, has come along and uncovered some deeply disturbing things that I would think anybody in public service would want to know and jump on immediately and stop. Stop the harm. This report revealing thousands of young Pennsylvania children are being experimented on with these sex reassignment drugs and happening right in our own backyard. They're going to be talking about this a little more in the legislature in Harrisburg soon. Beth Serio is with us, External Relations Manager at Do No Harm, to talk about these findings. And Beth, I welcome you in this morning. Hi.
Hi, Chris. Thank you so much for having me.
This is such a disgusting and disturbing story. I hate it. I just hate it. But thank goodness it's groups like yours that are calling attention to it. And what we clearly know is, in my opinion, I'm speaking here by myself and you can confirm or deny it, it's not like these children's hospitals and these children's medical practitioners are proud of what they're doing. They're really annoyed about what you're uncovering, and they don't like people talking about it publicly, which tells me they're not proud of it, which tells me they're cashing in on something that really should shame them.
That's exactly right, Chris. There are some hospitals and physicians that are truly activists in this area, and they are loud and proud on social media and advertising their services. But the truth is that's not the majority of them. I think that most hospitals and even these ideologues really know this is not a winning issue, and the position that they are pushing is just not something that resonates with your average American. Your average American knows that we don't perform, it is not right to perform experimental treatments on children who cannot consent to, tattoos, but yet we allow them to go on puberty blockers when they're 11 years old or have their breast cut off when they're 14 years old. So there's a, huge push by these hospitals to cover up what they're doing. And personally, we believe at Do No Harm that sunlight is the best disinfectant. I hate that this is happening, but if it is happening, everybody needs to know about it. And that's what we're hoping to accomplish through our report.
Sometimes I will hear people on the left say things like, when you talk about this transgender stuff and this gender reassignment stuff and kids, and you're really talking about some scant few. They always kind of dismiss it like it's which is kind of funny to me, because on the left they usually like to take fringe issues and blow them up as though they're real in front of everybody's face every day. But in this instance, the only thing they have to say about it is, you're making a mountain out of a molehill. This really isn't the universe of kids. It's not even a fraction of kids or whatever, as if one isn't worth saving and discussing. But anyway, this is actually, by the numbers, quite a bit more aggressive than you might suppose. I mean, based on the data you've collected.
Absolutely. Absolutely. And of course, I'm with you. One child is one too many in my view. But unfortunately, what we found is across the nation, about 14,000 children have been potentially permanently altered by undergoing these treatments. And yes, we've always been told it's not happening, or if it is happening, it's extremely rare. That's not what our data shows. And one thing I would also like to point out about our data is that we were extremely conservative in our analysis of the data and in our methodology. So we obtained this data through analysis of publicly available insurance claims data that of children who were between the ages of 0 and 17 and a half at the time of the treatment and had a diagnosis code of gender dysphoria or something related. Any data that was in, as you could say, maybe a gray area, we discarded and we didn't utilize. And there are certain things that we cannot account for, such as patients who were cash pay or self-pay, or patients whose insurance was Kaiser or Permanente because they don't and I believe that's a large insurer in Pennsylvania, but they do not report their data to the insurance claims database. And I say that just to point out again that while these numbers are staggering, I mean, again, we're talking 14,000 children across the United States, we know that it might just be the tip of the iceberg, and truly the numbers are even higher.
Because not all of them are reported, to your point.
Exactly. Not all of them were reported to the insurance claims database. And that is where we obtained our data from. So, again, I think that our data very clearly puts to rest the lie that this is not happening. And there's even more that could be done, honestly.
Here's a stat you guys come up with. And by the way, we're talking again to Beth Serio from Do No Harm. And the website, if you want to know more about this specifically, there's a release nationwide of a database of children's hospitals where this is chronicled, not just in Pennsylvania, but anywhere you live. StopTheHarmDatabase.com. StopTheHarmDatabase.com. What can people find there specifically, Beth? Because you guys have, just specific to Pennsylvania, taxpayer funding that has been spent on, quote, Pennsylvania medical assistance on sex reassignment and transition-related services and drugs between January 2015 through end of last year on people 18 years and younger. All right, so again, from the year 2015 through 2023, the amount of money spent on people doing this, 18 years of age or younger, your taxpayer money, $21,850,000. $21 million in taxpayer funds have been spent from 2015 to 2023 on people under the age of 18 having some form of this kind of butchery. I'll call it butchery. So that's the kind of data I assume you guys compile across the country?
Yes, that's correct. And I do want to clarify that the data you just quoted was from a separate research that was done by another great organization in Pennsylvania, the Pennsylvania Family Institute. So they compiled that research that you referenced, and wonderful, great research. It's a slightly more expansive than ours, mainly by the years and also by age. So we wanted to really focus on children. That's our mission at Do No Harm. We're opposed to treatments on children. So we cut off our age at 17 and a half to ensure that every child represented in our database was a child at the time of treatment. I believe the data that you are referencing, they include 18-year-olds, as you can imagine, is a huge jump. And we also looked at a slightly smaller time frame, 2019 to 2023. So just want to clarify that for your listeners.
Yeah, I'm grateful you did, because sincerely, the point is, though, I would say broadly, and thank you for pointing that out, that's the Pennsylvania Family Institute, if people want to look that information up. But more broadly, specifically, you guys focus on much younger children, and quite frankly, the foot has been put on the gas pedal. They go all the way back to 2015. The increased funding and the speed with which these things are happening, you guys zero in on, it's relatively recent. I mean, in the last even 5 years, right?
Yes, that's exactly right. Our data is from 2019 to 2023, but as we really got into this research and analyze all of this data on a very granular level, what we did find was a trend that was very disturbing, where you can see a massive jump between 2021 and 2022. This was true across the country, but it was absolutely true in Pennsylvania, where, like you said, it was, it was happening. It was happening before. We've been told it wasn't happening. It was definitely happening earlier on, but there was a huge jump in 2021 to 2022, where all of a sudden so many of these children, thousands across the country, presented for this medical treatment, and were just given it.
Gosh, what might have happened around that time, 2021 and 2022, when a bunch of minor children start going in for psychological damage through gender reassignment? What happened around 2021? What was going on? Oh, that's right. We locked everybody at home and screwed up their lives and trapped them in behind laptops, and forever altered their social lives and their educational lives. I wonder if that has anything to do with it. I know you're maybe not drawing that conclusion, but I will.
I think that's very fair. It's almost like there is a consequence to the things that we did in 2020.
Yeah, the psychology of what happened to so many young people, elementary and middle school aged kids during that lockdown, it messed kids up in ways that I don't think we still fully understand. And my daughter, was a younger girl then. She was in middle school then. Now she's a sophomore in high school, and I maintain to this day. And thank goodness she's a fully functioning, great young lady in a Christian school. But there's no doubt we see it, and she even knows it and feels it, and we talk about it. That the wiring got crossed with a lot of kids during that time. And we can't even really fully understand why or what it means. But here's the thing. You come along after a bunch of social media consumption, and they tell you, well, you know why you feel that way? You're probably really a boy. And there are a lot of parents that are like, okay, let's get right to the children's hospital and pump you full of pills to make you a boy then, if that's what'll make you better. That's what's going on. It's pretty easy to see.
That's exactly right. And I think it's also very important to point out this is just simply unprecedented in medical care and beyond. There's basically no other, especially medical intervention, where we just follow the child's lead and they say, well, I don't want to, have puberty, so I want to go on puberty blockers. And then the parents and medical providers say, okay, sure. I mean, in what other context would we ever do that? But so instead of helping these children through their discomfort with their biological sex, we're just simply medicalizing them at potential. We don't even know, fully all of the risks that these children are taking upon themselves for a lifetime.
I cannot imagine. I mean, I'm a parent. My kids are a little older now, but I can't imagine my kids coming to me in middle school or elementary school and saying, I don't think I'm the gender I am. And my immediate reaction is, without any kind of psychological analysis, without any kind of talking, without any real thought about it, just rush to a clinic and start them on hormone treatments. I don't know what that speaks to, what the psychology is there. Is that weak parenting? I'm asking you questions rhetorically you can't answer, but I'm wondering to myself, what kind of person, what kind of parent just says, well, I guess if the boy's unhappy and wants to be a girl, let's get him to the clinic and start filling him full of chemicals to try to alter that. It's insane to me, Beth. I don't get the psychology of it on parents' behalves.
I completely agree with you. I'm a parent too of 4 young children, and it's just absolutely unconscionable to me. I do think, though, that it's important to also point out some of the pressures that that the medical establishment has put on both just kind of your average medical provider, who may or may not, and very likely is not actually on board with these, and then also on parents. So we're constantly sold this lie, it's this classic, would you rather have a dead daughter or a living son, And so they really latch on to this talking point that if you do not follow your child's lead and allow them to immediately medicalize, then you will be responsible for your child's potential suicide, which is an absolutely abhorrent lie. And also, the data that we have does not support that conclusion whatsoever. We know that these children who medicalize, their mental health continues to suffer as they go through this process, which to me, I'm a nurse also by training, and that's not exactly a surprising fact to me.
And so here's the dynamic that's set up, and you can imagine it. A child is emotional, and because kids are, or down, or whatever, going through puberty, doesn't like themselves very much, doesn't like what they see when they look in the mirror. Welcome to being a kid in puberty. I'm not sure how many of us felt great. But now we're in a new generation where they tell a teacher or a counselor or something, because, they've seen a steady dose of it on social media or what have you. I don't think I'm who I'm supposed to be. I was born in the wrong body. Now you have a public school system that's been coached and trained to entertain that, push that, adopt that. In some states, even say we're going to keep that between us and we don't have to tell mom and dad about it. Maybe even foster a relationship with outside medical help to further the thing, again, without involving the parents. And in some states, we also know stories of where parents have been told and said, well, we're not going to turn my son into a girl or vice versa. And the parents are blamed, sometimes criminally prosecuted or threatened with that. And in cases of some adopted kids are taken from the home when the parents don't want to go along. I mean, this is really becoming cultish. It's almost like human sacrifice in a way.
Absolutely, absolutely, and that's why our database, the goal is, as it says in the tagline, exposing the child trans industry in America, because it truly is an industry and it's very multifaceted. And the medicalization, what we're exposing, is sort of that last step, along this pipeline that gets kids to the point of saying that they want to medically transition. There is so much that happens before they get to that point, as you point out, in the school system, among their peers, on social media, with their parents. It's a very multifaceted problem.
Oh, and what's so gross, some of our most respected children's hospitals and institutions across the country are capitalizing on this and taking advantage of the naivete and the guilt hostage-taking of parents and this manipulation by children online. These trusted children's hospitals and institutions are preying on the guilt of parents and the mental manipulation of children. It's the most insidious thing from hell that I think we've lived through yet as a culture. I really believe that.
Absolutely. These children's hospitals are respected institutions in our country for a reason. Historically, they've done amazing work and research to better the lives of children. So to have them now, many of these children's hospitals, CHOP in Philadelphia, right near you, is one of them, leading the charge on this activism to harm children. It's just such a dereliction of duty. It's absolutely unconscionable.
Yeah, and governors like Gavin Newsom in California are quite literally writing into law schools are not to tell the parents or they will be criminally prosecuted. I mean, it's, teachers and counselors are to keep this stuff secret from parents. That's how insidious this is.
Exactly. It's a no-win situation for families.
Beth, how can people find more information about what you have found?
So go to stoptheharmdatabase.com and you can see all of our research. You can look at the national stats. You can look at the stats for Pennsylvania, any other state, and then many of the children's hospitals as well. And if you want to learn more about our organization, again, it's Do No Harm Medicine. You can go to donoharmmedicine.org, become a member. We'll keep you in the loop on all of our latest updates.
And so, again, if you have a children's hospital in your community, wherever you happen to be listening, you can probably look them up in your database?
You absolutely can. And I would encourage your listeners, I know many of whom are in the Philadelphia area, to go and look up our data and our research on CHOP. But if there's any other children's hospitals that you're interested in looking up, we have profiles of about 100 of them available on the website. And we have data for every single hospital, every children's hospital or just general hospital in the country who has submitted any claims to insurance for these procedures. You'll be able to find that all on the website, stoptheharmdatabase.com.
Stoptheharmdatabase.com. Beth, we're going to stay in touch. Thank you for doing yeoman's work here. This is so important that the public know about it. I'm so grateful that you've taken the time.
Thank you so much, Chris. We really appreciate you.